A very good morning, students. Today we are going to discuss a topic that is anticonvulsants. So, first of all, we should know about the anticonvulsant drugs. Actually, anticonvulsant drugs are the drugs that are used to arrest convulsions or seizures caused in epilepsy. What is the epilepsy? Epilepsy is a common neurological abnormality. Okay? Common neurological abnormality. Epilepsy is a chronic disorder of brain function characterized by recurrent seizures, often accompanied by episodes of unconsciousness or amnesia. These are the seizures. So, anticonvulsants are the drugs that are used to arrest convulsions or seizures caused in epilepsy. The term epilepsy, based on the Greek word that is epilembion, means to seize, has been first mentioned by Hippocrates. And epilepsy is a disease that occurred due to central nervous system disorder, which is characterized by seizures and convulsions are abnormal body movement with the loss of consciousness. So, according to this, approximately 1% of the world population has epilepsy, and the second most common neurological disorder after stroke. Okay, this is the second most common neurological disorder after the stroke. Stroke is a different type of disease. So, up to 1990, approximately 16 anti seizure drugs were available, and 13 of them can be classified into 5 similar chemical groups, that is, barbiturates, hydantoin, oxa, lidendions, succinamides, and acetylurea. These groups have a common and similar heterocyclic ring structure with a variety of substituents for the drugs with the basic structures. The substituents on the heterocyclic rings determine the pharmacological classes, either anti-maximal electroshock or antipentenyl tetrazole. The remaining drugs, carbamazepine like valproic acid and benzodiazepines, are structurally dissimilar, and the newer drugs used are like felbamate, gabapentin, lamotrigines, oxcarbazepines, etc., etc., or like that vegabatrine and levetiracetam. The anticonvulsant therapy mediated by these drugs is through different aspects of neurotransmission inhibition in the brain by inhibiting sodium channels like phenytoin, for example, phenytoin drugs, or by inhibiting gamma aminobutyric acid, for example, GABA receptors, like, okay, and transaminase enzymes, for example, vigabatrin drug, and by inhibition of T-type calcium currents, for example, ethosuximide valproate, and by GABA agonistic activity, benzodiazepines. Actually, three principal type of epilepsy are found. They are follows this one: grand mal, petit mal, and psychomotor seizures. What is the grand mal? Grand mal seizures, in which the seizures last from 2 to 5 minutes, being characterized by a sudden loss of consciousness, tonic and clonic convulsions of all muscles associated with urinary incontinence. Number 2 is petit mal. What is the petit mal seizure is? The seizure lasts from 5 to 3 seconds, being characterized by brief attack of the unconsciousness. Usually occurs in children at the age of 4 to 8 years. And psychomotor seizure is characterized by the attack without consciousness and lasts from 2 to 3 minutes. Actually, the ideal anti-epileptic drug should completely suppress seizures in doses that do not cause sedation or other undecided CNS toxicity. Okay, and it should be well tolerated and highly effective against various type of seizures and devoid of undesirable side effects on vital organs and functions. So these are the anticonvulsant drugs. This is the introduction about the anticonvulsant drug and the epilepsy, a type of epilepsy according to their time limit. Okay, thank you.